I've given the most careful consideration after due consultation with many stakeholders, including the Ministers of Public Works and Health and the Civil Aviation Authority, to reopen our two international airports, the Chedijagan International Airport and the Eugene F. Correa International Airport, to commercial operations. Our country remains, along with the rest of the world, under the threat of the COVID-19 pandemic. We must learn to both live with it and deal with it. We're doing everything within our means and with the assistance of the international community to bring it under control. In the meantime, however, we must be able to keep our economy functioning and growing. We must be able to put our country back to work. I'm satisfied, on the advice of my ministers and the Director General of the Civil Aviation, that both our airports are fully prepared and are ready to operate in a manner which will ensure the safety of all who work there and pass through them. I appreciate the role that the private sector is playing in making this possible, in collaboration with the Ministry of Health, who will be ensuring that no one will enter our country through our airports without being subjected to the highest standard of testing. Like the rest of the world, we have entered into a new means of international travel. We have taken our time in order that we do it professionally and we do it right. Thank you, and God bless Guyana and its people.
Since March 18, 2020, the two international airports were facilitating repatriation flights, outgoing flights, cargo flights, medical evacuation flights, technical stops for fuel and special authorized flights. However, passenger commercial flights by all international airlines were suspended. The decision to fully reopen the international airports came after several months of preparation and extensive consultation with the various stakeholders to ensure that the two airports are ready to accommodate international commercial traffic. For passengers desirous of traveling to Guyana, they will be required to do a PCR COVID-19 test within 7 days of travel. If the PCR test is done within 72 hours of travel, the passenger will not be required to do another PCR test on arrival. If the PCR test is done between 4 to 7 days of travel, the passenger will be required to do a PCR test on arrival. The Guyana Civil Aviation Authority has developed a comprehensive list of health and safety measures at airports and on aircraft. These measures, which follow the guidelines of the ICAO and IATA, are complementary to those of the Ministry of Health, the World Health Organization. These measures are designed to ensure the safety of the traveling public. The Chedijagan International Airport has recently attained the Airport Health Accreditation from the Airports Council International, Latin America, and the Caribbean, ACI-LAC. This accreditation is testimony of the airport's ongoing commitment in prioritizing health and safety measures for all travelers as well as employees in light of the COVID-19 pandemic. The Eugene F. Correa International Airport is also in a state of readiness to accommodate international flights. Several assessments were conducted by the Guyana Civil Aviation Authority and the Ministry of Health, and the airport is ready after months of preparation. Given that some of these measures are new, passengers are advised to plan their travel ahead of time and be prepared to arrive early at international airports to give themselves enough time to go through the various screening protocols established. The traveling public is urged to exercise consideration, patience, and demonstrate a high degree of responsibility when traveling during this season of the pandemic. The health and well-being of our people are paramount, and your government will continuously evaluate the measures in place during this pandemic with the objective of making travel safe, secure, smooth, and pleasant. I implore the general public to strictly adhere to the health guidelines that are in place to protect against the spread of COVID-19.
We want to assure the public that we have taken the requisite medical and health measures to ensure that everyone who are utilizing the services are kept safe and healthy throughout the flight. Just to remind people about the safety measures that we have put in place. Before you leave the point of origin, persons would be required to have a negative PCR test. That test would then be used and would have to be validated by the authorities here in Guyana to ensure that it's an actual PCR test. Once it has been validated, you would then be allowed to book your flight and to come on the aircraft. If that test is within 72 hours, upon landing in Guyana and having followed all the protocols, you would be allowed to leave the airport and to go about your business. If, however, the PCR test that you have is more than 72 hours, then you would be required to do a second PCR test at the airport. And so we have put the necessary mechanisms in place for you to have that second test at the airport. We will be able to do the swabbing, and then we'll do the analysis. And while that is being done, you will have to remain at the airport. And once we confirm the results and that you are negative, then you will be allowed to leave the airport. In addition to these protocols, when you disembark the plane at Chadijagan International, we have a number of health staff that would be there. These persons are responsible for port health. They would be monitoring your temperature. You would be required to come to one of these port health officers, and they would fill up a questionnaire for you, having gone through a very short set of questions with you. They'll fill up that questionnaire, and once they're satisfied, you will then proceed to the next station. So we have taken a lot of measures to ensure that anyone who is traveling into Guyana would not bring the disease to Guyana. And we are very confident that these measures would work to prevent transmission.
The airport has been working closely with the Civil Aviation Authority and the COVID Task Force. We've been involved in several of the meetings in preparation for the reopening of the airport. Additionally, we would have also satisfied the requirements for the International Civil Aviation Organization, and we have been accredited certification, meaning that we have all the necessary measures in place to reopen the airport during this pandemic period. We'll be opening on October 12th. We had several meetings with the stakeholders. Passengers arriving in the country will require to have a COVID test, PCR test done within 7 days. Those having the test within 3 days will be allowed to clear customs, immigration, and depart. And those passengers who would have had a test done within 4 to 7 days, they'll be required to take an additional test at the airport. We have worked closely with the Port Health Authority and the airlines, and we have put measures in place for those passengers who will be required to remain at the airport while we await the results of the second test they would have done. So in all, I think the most important thing for us is having all the stakeholders on board and everyone know the role. We will try to make this experience as seamless as possible for the passenger. And we draw comfort from the fact that we would have been audited by the International Civil Aviation Organization in this regard. And I think we're only the second airport in this region to have got that certificate of accreditation.
The Chedijagan board is working to ensure every possible safety measure is available and installed and properly utilized. Our decisions are driven by available science, and we are following closely the international standards and the advice of the COVID-19 task force. As chairman of the board of directors of the Chedijagan Airport, I, along with the board and the staff of Chedijagan Airport, have set the safety of Guyanese above all else and insisted that every effort be made to ensure all arrivals are free of COVID-19 and that the testing and other medical procedures are completed with minimal discomfort and disruption to the traveling experience. We are doing everything to make sure that there are minimal delays and maximum safety. The Chedijagan Airport Board is aware of the need for essential travel as Guyana's economy prepares to take flight and will continue to monitor the latest science on the prevention of the spread of COVID-19 and modify systems in place to be consistent with the newest credible information. The board intends to review our protocols and procedures on a twice-weekly basis to ensure maximum efficiency and safety. We are committed to making this process as safe and as efficient as humanly possible. The Chedijagan board asks the traveling public to be patient with the systems and to cooperate fully with all directives by the airport authorities for your safety and security, and that of your friends, your family, and all persons in Guyana in these testing days.
We fully support the government in this idea of reopening for many reasons, increasing the connectivity with the Caribbean and regional destinations, giving the Guyanese traveling public some options, and doing it in a manner which is safe for Guyana and its people from COVID. The airport itself expects the first flights in around the 19th from Caribbean Airlines. We have worked with the Chief Medical Officer from the Ministry of Health and the Guyana Civil Aviation Authority, Colonel Egbert Field, the DG, and we have met all of their requirements. And we are satisfied that we can open the airport in a safe manner. What has happened is all the protocols that they have recommended and required, we have put in place, like social distancing, sanitization, masks in place, separations on the floor, all that stuff. And you saw the new incoming area, which has been very well laid out, all stainless steel, so it can be properly sanitized. All of that has been done to make sure we are ready. And as far as we're concerned, right now, we are ready.